out. So we have like actually three pretty darn cool modalities in here. So over back behind me, those black like looking like leg sleeves up there, those are the Normatec compression boots. So athletes like using them, and the reason that athletes use them is basically for recovery. So what they do is they basically work on, it's called pneumatic compression. So a frequent question that I get is, are they the same as compressions? Basically, compression socks, they're different. So compression sock, you're basically going to have the constant compression, but the Normatec compression boots work on something called pneumatic compression. Pneumatic compression, the best analogy for it is you have your two types of people. You have people that when they're close to the end of their toothpaste, they'll just, get the last squeeze out, throw it away. And then you got those people that basically inch all they can to get everything out of the container before they throw their toothpaste away. That's kind of essentially what this does. So what they do is they will, when you put the sleeve on your leg, it basically goes all the way up to your groin. And what it's going to do is flush all of your lactic acid and all the metabolic waste out of your tissues. And then it gets highly oxygenated and nutrient dense when it goes through your vital organs. And so when the blood goes back to your legs, you get all the good healing factors. That's why athletes love them. They were a hot commodity around here 2 weeks ago, post marathon. And so basically, it's going to flush all the lactic acid. It's also going to help drain lymphatic system. And also, this actually got studied by the FDA for treatment of stage 1 varicose veins. There are a couple contraindications to the Normatec compression boots. Congestive heart failure, severe atherosclerosis, high blood pressure, uncontrolled blood pressure. But if you're not an athlete and you're not using it to basically flush lactic acid, what it also does, like just everyday people could use them if you do have varicose veins. If you want to increase circulation and people with diabetes, so diabetic neuropathy in their feet, these work great with. And so basically, what is I call it giving you a fresh set of legs. So it's going to drain it's going to drain your lymph through your lymphatic system out of your legs, increase oxygen, and then it will also deliver oxygen a little bit more readily available to your legs. And then next, I'm just going to flash the lights here real quick. So that is our infrared sauna. Couple differences between saunas. So conventional sauna, that usually gets anywhere from 150 to 180 degrees and actually heats the air around the person in there. This is an infrared, far infrared sauna. So this actually is going to be around anywhere from 120 or 125 degrees up to 150 degrees. And it actually heats your own body's tissue. The good analogy for this one is, if you're going to cook something, if you put it in your oven, the conventional oven is kind of like a conventional sauna. And then if you would put something in a microwave, how the microwave heats the molecules up in the food, same thing. So kind of like an infrared sauna. So what people use the infrared sauna for, detox. That's one of the biggest things. And if you use the infrared sauna, we suggest that you don't get a shower up until an hour after. And here's the reason why. So when you're in an infrared sauna and you're detoxing, if you get in a shower, a couple minutes after you're out of the sauna, your pores are still wide open because you were in such a hot environment. So if you do get in a shower, right after the fact, sometimes you could actually wash some of the toxins back into your system, which you're not trying to do. So I usually recommend, as a rule of thumb, as soon as you're out of here, I know it's nasty, don't shower for an hour after, just so you could actually have that detoxification effect. Another cool study I came up on, this was in 2022. This was in Sweden and Switzerland. And they studied, the control group was middle-aged women who exercised versus middle-aged women who sat in an infrared sauna. It was 25 minutes 4 times a week. Long story short, they compared the control group, so the women who exercise compared to the women who just used the sauna, and they saw that an infrared sauna session mimics cardiovascular activity. So I thought that was pretty interesting. So anybody watching online, if you have any family member, friend, any loved ones that cannot exercise, get a cardiovascular workout due to you're morbidly obese, you had a double knee replacement, double hip replacement, you're just kind of like depressed, to be honest with you, and you just can't really just initiate your exercise. This is literally one of the best things that you could do to kind of mimic the cardiovascular activity, just to kind of like exercise your heart, so to speak. And then the last thing that we have is Bobby likes to call it the shake machine. It is vibration therapy, and that is also for massive lymphatic drainage. I like to use it with people struggling with any kind of balance issues. There is a contraindication to the shake machine. You don't want to put someone who had a stroke just because you don't want to shake everything up, obviously. But that is actually studied for lymphatic drainage, and they actually saw some studies about weight loss, what it does for that. My personal opinion, why I like the vibration therapy is I like to stretch on it. So, for example, if you're going to stretch your hamstrings, you just go down to stretch your hamstrings, you'll get to a certain point. But if you're actually on the vibration therapy plate, you're actually just going to get a little bit more bang for your buck and be able to go a little bit lower when you're actually stretching different tissues on there. If you're using it for lymphatic drainage, I recommend patients when you're on every 30 seconds, just stand for 30 seconds, arms up for 30 seconds. You can put them back down and then kind of just do sets of holding your arms up. And then lastly, people with any kind of like stiffness in their knee, doc, my hip just feels like it's locked up. My knee feels like it doesn't want to bend how it used to. I'll actually get people to hang out in a deep squat on the shake machine. And Phil, you think we could maybe even just demo it so they can see what it looks like? So you just stand on it, and then there's a couple different settings. Can you see me shaking at all? Yeah. So yeah, when we were talking about the lymphatic drainage, basically just hanging out with your arms up. And then I kind of like to stretch and just kind of get into a deep squat. So I'll recommend patients getting kind of like an athletic posture. And then you could kind of just go down and hang out in a deep squat. And then I kind of just move around as well. So it's going to help with ankle mobility. It's going to help with your knee and for your hip as well. And it's kind of crazy. Like when you get off of this, you feel 10 or 15 pounds lighter on your feet. And actually, I also do have another patient that she's suffering from MS. And there's actually a couple studies about what getting on the vibration therapy does to help basically just not slow down your MS symptoms, kind of calm down your symptoms of your MS, just because it's going to try and link your brain up more towards your leg. So when you're walking, whatever side of symptoms your MS is basically messing up, you're just going to feel like better in your body, so to speak. So yeah, these are a couple of our therapies that we use in the recovery room. People absolutely love the Normatec compression boots just because you get a fresh set of legs. I'm actually popping in the infrared sauna after work today. I try and get in there at least once a week, and I'm in there for anywhere from 30 to 35 minutes, right at 150 degrees, just for the detoxification purpose. There are a lot of studies actually what infrared sauna does for hormones in your brain as well, and actually your hormones. If you want to use infrared sauna for basically brain function and hormone balance, you are basically only going to do one sauna session a week instead of using it every single day. So it's just basically one treatment day, and you're going to be in there for 30 minutes, out for 5, in for 30, out for 5, and then you repeat, in for 30, out for 5, in for 30, out for 5. So 2 hours and 20 minutes once a day is where you're actually going to have your maximum increase of basically brain function, and it kind of just helps to regulate your hormones. But for detoxification purposes, every other day, every 3 days, anywhere from 20 to 25 minutes is a great treatment time. So we just kind of wanted to show you our recovery room. We throw the TV on. Golf is going to be on this afternoon for sure. So if anybody ever has any questions or wants to come check them out, give us a call and we'll talk about it. So thanks for tuning in, guys.
Those are available to try out this week, right?
Yeah. So they're available. When you come in, talk to the front office, and then we'll talk about why you're using it. Just because there are a couple contraindications, we just have to make sure that these modalities are right for you, and we'll just talk over that real quick, and then you're able to try them out.
Yeah. What's normally the cost of these?
So the Normatec compression boots are $20. Sauna is, I believe, $30.
And that's for half an hour? Or?
Half an hour, yeah. So sauna is going to be for a half an hour. The Normatec compression boots are going to be anywhere from 20 to 30 minutes. And then the vibration therapy is anywhere from 10 to 12 minutes. And I believe the sauna is 30, Normatec compression boots are 20, and then the vibration therapy is 20. Again, this is basically just going to try and aid in your recovery time, increase circulation, especially with the boots. And a lot of people never been on the vibration therapy. It is kind of weird, but I'll tell you what, like after you get off of it, it just kind of helps with your joint proprioception. So proprioception is a fancy word for where your body's at in space. So if you get off the vibration therapy, you actually kind of feel a little bit more comfortable in your own skin. You just feel a little bit more athletic, to be honest with you. So any other questions?
Nice. No, yeah, these are free until tomorrow to try out.
Free until tomorrow to try out. Yeah.
Normally, but they're here all the time, right?
Here all the time, absolutely. And you just call, and then we'll talk to the front office, and we'll get you on the schedule for them. And yeah, a lot of patients like to come in once a week, honestly, to use the Normatec compression boots, depending on their training season. There's multiple people that come in. There's about every other week, and they're getting in the sauna just for a detoxification. And then it's kind of hit or miss on the vibration therapy. Some people use it, some people don't. But yeah, you just call, and we'll put you on the schedule, and then we'll get you on the modalities.
You like to put people on the boots like right after an appointment.
Yes.
Correct? Is that like for everybody or certain people?
Depends. So for the athletes, especially the D1 athletes, professional athletes, I just like to put them on because it gives them a fresh set of legs, so to speak. Since they have such a high intensity of training regimen, every time you move, your cells are creating waste, and they have a huge accumulation of lactic acid. So we basically just put them on the boots to basically flush everything out, so their recovery time shortened. If people are struggling with any kind of circulation or peripheral neuropathy from diabetes, numbness and tingling, your feet don't feel right, they don't feel like how they used to, then I'll definitely put them on there as well. Again, we're just basically trying to increase the blood flow down to the distal extremity, so you could kind of feel them a little bit better in the peripheral neuropathy. And then I basically couple that up with the topical lipoderm CBD in the clinic, in the treatment room, coupled with the laser therapy, and we get great results with that as well.
Nice.
Sound good?
Thanks, Dr. Ross.
All right, not a problem at all.